Hello, everyone. My name is Deontay Marquis. I am a family nurse practitioner and registered nurse. Um, and today I will be teaching you all about nebulizers. Specifically, we will be talking about why, how, and when we use nebulizers. And today's presentation, of course, is brought to you by myelftraining.com. So let's begin. Now, there are a few course objectives that we're going to go over first here. And these are just the specifics of what I hope to accomplish in today's presentation. The things that I want you guys to walk away from and to know, and how I want you to be able to apply them into your practice after today's presentation. So, our first course objective is by the end of this presentation, you should understand and be able to define what a nebulizer is and understand its function as well. Um, so you should know how it works and the specifics of it. At the end of this presentation, you'll also be able to discuss the differences between the three types of nebulizers. So we'll touch on that a bit, the different types of nebulizers, just small changes between them because you don't know what kind of nebulizer you are going to encounter in your practice. And we have to be prepared for anything, right? Right. Also, by the end of this presentation, you will be able to identify all parts of a nebulizer and their function. A nebulizer doesn't have too many parts, but it's important that we know their functions. So if ever there is a problem, troubleshooting won't be difficult for us because we know all the parts of the nebulizer. We know what they're supposed to be doing, and therefore we'll be able to fix the issue. If there is some small issue, we can help our patients with them to continue their treatment. By the end of this presentation, you will be able to discuss the step-by-step procedure for administering, butchered that word, for administering medications via nebulization. So we will talk about how to set up the nebulizer to administer medications through the nebulizer. Our last two course objectives here, you will be able to recognize and differentiate between adverse and general side effects caused by common medications administered via nebulization. We know for any handful of medications, there's always 2 or 3 times more handfuls of side effects for those medications. So for nebulized medications, we want to focus on the most common ones and the adverse effects, the really detrimental ones that we want to be on the lookout for. And last but not least, you should understand and be able to discuss the different diseases that may require medications to be administered via nebulization. So we want to know the disease states of the patients that we're going to be caring for so we can therefore better be informed about how to care for those patients, what to expect, how well should we expect them to respond to the treatment, and symptoms that may indicate that they need a treatment. So it's always important to know your medications and to also be able to recognize and place those medications with specific diseases. So let me move myself over here for a second. Okay. What is a nebulizer? So, a nebulizer, it's actually quite simple. It's a machine that turns a liquid into a very fine mist. Very simple. That's all it is. It's a machine that turns a liquid into a very fine mist. And that mist, that liquid is the medication. And that mist is also the medication mixing with oxygen or compressed air. that turns that liquid into a mist that the patient can then inhale through a face mask or a mouthpiece. And this allows the medication to be delivered directly into the lungs. And also, it's done very quickly. So I have this here because the medication starts out as a liquid and then it's mystified into almost a gas. It's like a mist in the air that the patient can inhale. And you can also see it here. It just looks like soft steam from the machine there. And this is the most efficient delivery system for these medications. So, what is a nebulizer versus an inhaler? What is the difference? Which one is better? And you'll see here I've already circled nebulizer because the nebulizer is more efficient than a meter dose inhaler. The difference is children, we can't give them nebulizers because sometimes the delivery of the medication takes a while, and setting up the equipment and things, it's not portable. But adult patients who are living at an assisted living facility or in a hospital or in an acute care facility, we can easily keep a nebulizer machine there. We can set it up for them, teach them how to set it up, and administer this medication fully without worrying about them getting up or leaving or not following the instructions or not being able to sit still for the full duration of the treatment. So, nebulizer is a machine that turns a liquid into a very fine mist. We talked about that. And the medication is delivered into the lungs very quickly because it is mystified. But depending on the medication, it can usually take 20 minutes or less to inhale the medicine. So the patient has to sit for the treatment that's going to last 20 minutes. Now, the difference between a nebulizer and a metered dose inhaler. Now, the name alone should tell you a lot about the inhaler. It's a metered dose, which means that you can dial in a certain meter or amount of a medication to be inhaled. And this is most commonly prescribed, very similar to like a small aerosol can, where the medication, the device pushes out a pre-measured amount of the medication. And when the person squeezes the inhaler to take that gulp, they inhale that medication directly to the lungs, and it's a measured amount of medication in that puff. But this medication is received instantly, but it's not as effective as a nebulizer. But that's okay, it still gets the job done. A little bit more just comparing a nebulizer versus an inhaler. Nebulizer is easier to use. An inhaler requires practice to use properly. So that's a big difference there. Um, they have to practice in order to get more and more efficient with it. The time, the breath, the inhalation of the medication to get things correctly. Whereas in a nebulizer, you just put the mask on or you just give them the mouthpiece and they're done. Come back in 20 minutes. A nebulizer doesn't require an aerosol additive, which is just what is put inside of an aerosol can so that the spray can be pushed out. And this is the same for an inhaler. But the inhaler doesn't require a power source. So the nebulizer needs a power source, but it doesn't need an aerosol additive. Whereas the inhaler doesn't need a power source, but it does need an aerosol additive. And then I put a note here. If traveling, always be sure to have a backup battery or charging cable to ensure that the patient can receive their treatment wherever they are if they have a nebulizer. So you want to always be sure, even if you're walking with your patient somewhere, you want to always be sure that if they pack that nebulizer, that it's either charged before you guys go. If it's not battery operated, then you have the charging cable or you have a backup battery to attach to it. Okay. Now, let's get into the mechanics of the nebulizer. So we've already talked about this liquid medication and how it mixes with the compressed air. We talked about the aerosol additive that's similar to that's in the aerosol can. So what happens is the liquid medication it mixes with compressed air, and it goes through a very narrow tube which enters into a wider chamber or area. And this increase in the volume of compressed air, because it's entered into a wider area, leads to a reduced amount of pressure. And then it turns the liquid into very, very small droplets. I know this is just this is more physics, but just so you can have an idea of what's going on, and how this nebulizer turns liquid into smaller droplets that can flow with air, small enough to flow with air. And this is just a diagram of what happens. So now the anatomy of a nebulizer. This is where you guys want to pay attention. We're not really physics majors, but I wanted to put this in here for you just in case you were curious. But we are patient majors. We major in our patients. So you guys want to pay attention here. So this is what is called the compressor. This is what they refer to as the machine. This is doing all of the work. And this, if you remember here from this slide, the this is the three hookups that you can attach to the compressor. It can either be oxygen, compressed air, or ultrasonic power that will push through some air, and that's what the liquid medication or nebulizer medication will then flow through its droplets up once the medication is turned into small droplets. That's how the medication will get into the lungs and flow through the tubes. It'll either mix with oxygen, compressed air, or ultrasonic power. So here, let's imagine that it's just hooked up to simple oxygen. It's oxygen that is coming through the wall, and we have it attached to the compressor. This is just tubing here. The nebulizer cap. So this is where that pressurized action I was telling you about, that's where this happens, where the change in size and the change in pressure causes it to mix with the air. And this is a mouthpiece. So the patient takes in the medication here, and anything that's not medication comes out here. So before we go on, I actually want to show you guys those pieces. So when you go into the stock room and you're preparing to give your patient a aerosol treatment, a nebulizer treatment, you will need a face mask, which will look like this, and it'll have this here for you to attach to the oxygen tube. So instead of this mouthpiece here, you can give them a face mask. Or I have a mouthpiece here to show you guys. Now see, this is that small compressed device here. And then this is what the mouthpiece would look like. So it almost looks like a cigar. And you'll put that together and connect that with your tubing. and initiate your patient's treatment. Now, what type of patient would you imagine would need nebulizer therapy? What type of patient, what type of symptoms would they be exhibiting that would let you know, hey, my patient is one that will probably need nebulizer treatments, or I already know that my patient has one of the diseases I have listed here. Um, but what type of assessment, what type of assessment findings would clue you in to let you know that you need to order nebulizer therapy for your patient, or that would clue you in to actually go on ahead and administer nebulizer therapy at your facility if you guys don't have specified respiratory nurses or therapists to uh, perform all of the respiratory treatments. So it would be a patient who has a history or currently has asthma or bronchitis or cystic fibrosis or COPD or a respiratory infection. And why these specific diseases? Because they all relate to the inability for the patient to fully expand their lungs. Um, and when I say fully expand the lungs, it's just because they have a weakened respiratory system down to the alveoli, which aren't expanding properly and retaining air. So they need extra medicine to help them to not only expand their lungs, but also sometimes to dilate uh, and restore the elasticity to the lung muscle so that it can fill properly and fully when they take a breath, and also shrink when they breathe out. Some of their respiratory muscles have become weak, so they don't fully expand. So it's very difficult for the patient to take a full breath and feel that they no longer need air. Um, Also, patients with cystic fibrosis, respiratory infection, COPD, since they have a decreased elasticity of the lungs, what else can we guess that they're having problems with? They're having problems expelling mucus. They have this irritation in their lungs, bronchitis, itis, inflammation. So they have this inflammation in their lungs. They have increased mucus production, and they have decreased elasticity of the muscles inside their lungs, of the alveoli. So they need assistance with removing those. With removing the mucus that's building up inside of their bronchial tubes. And they don't have enough strength inside their lungs to do so. So those are the types of patients that could most benefit from nebulizer therapy. And most commonly, those patients have either asthma, bronchitis, cystic fibrosis, COPD, or some type of respiratory infection, whether it's community acquired pneumonia or what have you. So, before we get into the medications, I want to show you guys a video.
We'll also want to ensure that the patient is in the correct position. I'm going to put the head of the bed to approximately 30 to 45 degrees. An important performance note about jet nebulizers is that they should be oriented approximately vertically to work effectively. Tilting the
Okay.
device too far, perhaps.
Whoops, what happened there? Okay, so while I'm reprogramming this,
The patient is in the correct
what
position.
this gentleman
I'm going to put the head of the
said,
bed to approximately 30 to 45 degrees.
what that gentleman said was that with when administering nebulizer treatment, we want to make sure that the patient's head of the bed is positioned to at least 30 to 45 degrees. Now, there is a reason why he said this, and he was illustrating why before my computer slowed down there. It's because the medication, there's a liquid medication that is going to sit inside here. So this is going, so when you're preparing the medication, you're going to take this top off. You're going to put the medication drops in here. So let's pretend that water here is the medication. There we go. So you see we have little drops of the medication there. And then you're going to put the top back on. Screws on like that. Okay, now let's see what else he was giving us some good information there.
To approximately 30 to 45 degrees. An important performance note about jet nebulizers is that they should be oriented approximately vertically to work effectively. Tilting the device too far, perhaps 20 to 30 degrees on any angle, in any direction, can cause the medication to move away from the jet gas port inside the device and render the treatment ineffective. If you notice a treatment you are administering is taking a long period of time, or there doesn't appear to be an appropriate volume of aerosol generated.
So as you can see here, we have a correct way to administer a nebulizer treatment and an incorrect way. So the correct way is the patient's head is more elevated, probably between 30 and 45 degrees. And therefore, the way that the mask is fitting around his face that is connected to the nebulization medication port here is not flowing. It's sitting level. It's not flowing into the chamber here. But here, it is sitting more sideways. It's tilted away from the port. So if it's tilted away from the port, then as I showed you guys with our quick physics lesson, the medication isn't being turned into small enough particle. All of the medication isn't being turned into small enough particles to allow it to flow with either the oxygen or the whatever you're using to push the medication through into the lungs. So it's very important to remember that when we are trying to administer medication to the patient. So let's continue.
You may want to check the nebulizer to ensure proper vertical orientation. Next, I'm going to connect the nebulizer to our gas source using oxygen tubing. It should be noted that in order to adequately power jet nebulizers, a specific gas flow is required for this device. The manufacturer in this case recommends 9 liters per minute. However, it doesn't necessarily matter what type of gas. It could be 100% O2, air, heliox, etc. You'll need to exercise good clinical judgment to determine the appropriate gas for your treatment.
So when you're determining the appropriate gas for your treatment, usually 9 times out of 10, it's oxygen. The flow, if you're unsure of the flow, you can check the packaging on the specific medication that you're preparing to administer, or perhaps there is a standard that your facility uses. Otherwise, you can refer to the medication packaging, which would be my best bet. So we saw how he connects the face mask to the patient. And we also saw how we connect the port for our medication to the tubing. So we have our face mask and we have our medication port. And we connect them nice and tight. And preferably, if you want to keep this sitting level to get an effective flow for the medication, then we want the patient sitting up in a chair, completely upright, 90 degrees. But sometimes that's not always achievable. If that's not achievable, then we want the patient laying down 30 to a 45-degree angle, and we're watching the medication in the chamber there. Let me add a little more medication just to give you guys a real life visual. Our perceived medication. All right. So As you can see, our medication is there. And let's continue.
Time, or there doesn't appear to be an appropriate volume of aerosol generated, you may want to check the nebulizer to ensure proper vertical orientation. Next, I'm going to connect the nebulizer to our gas source using oxygen tubing. It should be noted that in order to adequately power jet nebulizers, a specific gas flow is required for this device. The manufacturer in this case recommends 9 liters per minute. However, it doesn't necessarily matter what type of gas. It could be 100% O2, air, heliox, etc. You'll need to exercise good clinical judgment to determine the appropriate gas for your treatment. Often, patients receive 100% oxygen if there are no contraindications, simply because this is the most readily available compressed gas in most institutions. But importantly, make sure that the gas flow is not running when you connect it. You should wait until the setup is complete and the device is adequately.
This is another key point. We do not want to turn on the flow of oxygen, air, anything until the patient is connected to the medication and everything is in place. Why? Because if you do, then some of the medication will be wasted while we're continuing to hook up the patient and complete the setup of the nebulizer treatment. And the patient won't get 100% of the medication that they need. So this is another key point. Don't turn on the oxygen flow until the patient is completely set up.
Affixed to the child before you start the gas flow. This will minimize the amount of wasted drug and maximize the received dose. Next, I have our drug. I've removed the cap and I'm going to take our medication, which is in a liquid suspension, and place it inside the device. We're going to replace the cap, attach the interface, affix the oxygen tubing to the bottom portion of the nebulizer.
Okay, let me affix my oxygen portion to the bottom of my nebulizer. And here they have it color coded for you. So blue makes the blue. And the green will go to the wall. And if you look at the wall oxygen port, it's also green. So that way we can't make a mistake.
And place the mask on our patient.
I'll show you guys here.
Affix the oxygen tubing to the bottom portion of the nebulizer and place the mask on our patient.
And we affix this to the wall.
I'm going to turn the oxygen flow rate onto 9 liters per minute as per recommendations by the manufacturer. This treatment should last anywhere from 10 to 20 minutes.
And that's it. I'm ready for my nebulizer treatment, guys. Okay, so if we're using the wall oxygen, it's pretty simple setup. Even if you're using a compression machine, a portable nebulizer compression machine, it's pretty simple. The main things that we talked about that I wanted you to learn from that video was to not turn the air or oxygen source on until everything is set up. And the second most important thing I wanted you guys to learn from that video is to not lay the patient flat, to keep them sitting up at a 30 to 45 degree angle. Those are the most important takeaways I want you to remember when we're setting up the nebulizer treatment for our patient. So now back to where we left off. Right before this slide, you remember we were talking about the types of patients who actually need nebulizer therapy. So now we're going to talk about the medications that those patients might need. So what medications can be delivered? So the medications that can be delivered through a nebulizer treatment would be bronchodilators. And bronchodilators are drugs that help to keep the airways open. They help make breathing easier for the patient. And doctors, they use these medications very commonly. And one of the most common bronchodilators that you probably have administered or seen on your patient's medication profile would be albuterol. Albuterol is one of the single most common medications that we see doctors order for our patients. And these help treat patients, of course, with asthma, COPD, um, bronchitis. They make breathing easy for the patient. Now, another medication that's very commonly given through a nebulizer, second to albuterol and bronchodilators, would be saline, simple sterile saline. I have seen this medication used numerous times, and it's used specifically to break up and loosen mucus that's trapped inside the lungs. I've seen it used almost daily when I worked in the ICU. I'd be caring for patients on a ventilator or patients who are really struggling to breathe and require a lot of suctioning. So, patients that have a lot of mucus. And we would go in and administer this medication, albuterol, which is just almost very similar to water. And what it does is just liquefies the mucus and makes it a lot easier for the patient to bring up or easier for us to, in the ICU, go in and suction from the lungs ourselves. So a sterile saline solution is very common, something we administer all the time. It's just like a fine mist, and it goes inside the lungs, breaks up the mucus, and this can do wonders for your patient if they're having a lot of trouble with mucus and they can't bring it up, or they're coughing and they're not bringing up the mucus, it's just saliva, but they feel like they have mucus. So a sterile saline solution can help. And last but not least, an unfortunate medication that a patient would have to get because it means that they have some type of respiratory infection and they are really struggling. And that is an nebulized antibiotic. Commonly, we'll see tobramycin. Now, a nebulizer can be used just as we use it for bronchodilator, just as we use it for sterile saline. It can be used to administer antibiotic the same way, but it has a different effect. It doesn't exactly help the patient breathe easier. It doesn't exactly help to loosen or extract any mucus from the patient, but it does help to kill bacteria that has somehow gotten inside the lungs and is causing the patient this infection inside their lungs, and it's going directly into the lungs. So it's very effective. If you believe your patient is suffering from respiratory infection, has gotten one somehow, then uh, requesting nebulized antibiotic will do wonders for your patient. Now, what are the side effects of these medications? We've talked about the positive aspects of them, how they can help our patient. What harm will they bring to our patient, or what side effects should we expect? If I give this to my patient, what side effect should I expect as normal, and what side effects should let me know that something more serious is going on? So, bronchodilators, we'll start there. Bronchodilators, we can expect side effects such as nervousness, shakiness, headaches, throat or nasal irritation, and that's mostly just because inhaling the medication, it's a foreign mist, a foreign body inside. It's passing through those sensitive respiratory tissues. It will cause some irritation for the patient. And muscle aches. It can also cause muscle aches. So these are some of the expected side effects of bronchodilators. Now, more serious side effects that should clue us in to maybe even stopping the treatment or letting the doctor know to maybe modify the dose of medication, or maybe there's some medication we're going to give to counteract the more serious side effect, would be tachycardia. So if you go in and your patient needs a nebulizer, albuterol, the doctor has ordered albuterol to be nebulized to be given at noon, and you go in at 11:30 and assess your patient and prepare the treatment. You pull the medication, you sit your patient up 30 to 45 degrees, and you let them know that you're about to administer albuterol. But you do your assessment and you see that they have a heart rate of 125. And this is not their normal heart rate. Their normal heart rate is 70. So you ask them, are they nervous? You assess the medication administration record to see what medications have been given that can cause the heart rate to go up this high, and you don't see anything, and they say that they're not nervous. We should probably keep an eye on this patient very closely during this treatment. And if their heart rate starts to creep up even higher and higher, then we may want to stop this medication, because we know that bronchodilators can cause tachycardia. And this can lead to palpitations or feelings of fluttering. So we don't want to put our patient through that. If they have tachycardia at the time we go in, we want to maybe let the doctor know and administer this medication at a later time when their heart rate isn't elevated, when it's more in a normal space for them. Or if they normally have an elevated heart rate and we notice that they're having a serious side effect of tachycardia to the medication, then we want to make sure that we let the doctor know, so he or she can come and assess and make sure that it's still safe to give this patient this medication, and recognize that this patient does have a high heart rate and that it is okay to give albuterol to this patient. So, uh, next would be sterile saline solution. What are some side effects to sterile saline? Well, similar side effects to bronchodilators. We can expect nervousness, shaking, headache, but also nausea or dizziness may occur. And I'm presuming that's related to the sodium in the saline, that may cause nausea or dizziness. Not anything we should worry about as far as the sodium and the blood pressure goes, because it's just being inhaled and then probably absorbed through the mucosa. But knowing that this medication does cause nausea or dizziness, I would say I want to make sure that this patient takes their treatment after they've already, no, before they've already eaten or after they've already eaten. Um, I would say to take it before they've eaten if they are someone who usually has vomited before, or who complains of nausea. But if it's someone who doesn't usually vomit but does complain of nausea, but we have a hard time getting to eat, if it's a patient who doesn't like to finish their meals, then we don't want to make them nauseous before a meal, because they're not likely to finish that meal or even want to participate in the meal. So we want to assess our patient. You need to know your patient, what type of patient you have, as far as the nausea for a side effect, or maybe have a medication that will counteract that nausea beforehand. And also dizziness. We need to be aware of dizziness. If the patient wants to stand and walk after the treatment, they've been sitting down for 15 to 20 minutes to receive the treatment, they're probably going to want to get up once it's done. We need to make sure that we help them stand up and make sure that they've gathered their bearings again after standing up, and they're not going to have excessive dizziness, which may lead to a fall, which is the last thing we want, is a fall. So sterile saline, nausea, dizziness, nervous shaking. Now, tobramycin, our antibiotics. What type of side effects can we expect when we're administering antibiotics to our patients? Well, antibiotics are a bit different, and they vary, the side effects vary with which specific antibiotic we're given, but generally, no very serious side effects, but we can expect coughing, wheezing, and hemoptysis. Hemoptysis, which you should know, is bloody sputum or blood in the sputum, and also dyspnea, shortness of breath. Now we talked about how in bronchodilators they can cause throat or nasal irritation. So hemoptysis to me would indicate that antibiotics can cause even a more severe irritation, which is so severe or more expressed that it causes hemoptysis or bloody sputum. So uh, if the patient spits blood after receiving an inhaled nebulized antibiotic, then we know that that's normal. That's something they can expect. And we can even tell them before they receive the treatment so that it's something that they expect. So when and if it occurs, they don't panic, they don't freak out. We told them that that this might happen, and it did. So if anything, we're looking like we're already 2 steps ahead, and we're taking great care of our patient because we told them that this is what they can expect and it's normal. We already did our how-to video, so let's talk a bit more about administering a nebulizer. So one thing that was not covered in the video that I showed you guys, but we should already know as healthcare professionals, is to always wash our hands with soap and water. Now, why is it more important to wash our hands with soap and water when we're administering a nebulizer medication? Because if you saw in the video and also in my demonstration, when I filled our medicine chamber here with medication, okay, our fingers touch directly in that chamber and touch the medication directly. So we want to make sure that our hands are clean. Why? Because this medication is inhaled directly into the lungs. And we don't want any bacteria on our hands to also travel with the medication directly into the patient's lungs. So we want to make sure that we wash our hands with soap and water, put on gloves, and we don't touch anything before we touch that medication chamber and are ready to put the medication into the chamber. Now, preparing the machine. Now, in the video, there was no machine. It was wall operated. But sometimes your patient may have a machine, and it's no different than the wall. You connect it to the wall, and there's usually an on button and an outlet to plug it into the wall. But you should always remember that the machine should be flat on a hard surface. You shouldn't sit it in the bed with the patient. Um, it should be flat on a surface. And you should also check the air filter for cleanliness. And if it needs to be clean, then you need to clean it with cold water and sit it out on a towel to be air dried. Okay? So if the patient has a machine, we need to remember to always lay the machine on a hard surface, not in the patient's lap, on their bedside table, preferably next to them. And make sure that we're checking the air filter for cleanliness. Clean it with cold water. No soap is necessary. And air dry it. Now, preparing the medicine. In the video, the medicine was pre-mixed, and most of the time it is. All we have to do is pour it into our medicine chamber and then connect that to the mask and place it around our patient's face. If it's not pre-mixed, then we want to add the nebulizer using a dropper, a small dropper, or empty syringe. And this is just so we can measure the medicine in a liquefied form to the appropriate amount. Step 4, asterisks around it because it's not always a needed step. Sometimes it is, but sometimes you have to add saline. That's if the medication is not pre-mixed. Now, I did include this here because sometimes the patients may go home for a day or two, or they may have visitors and they may want to set up the nebulizer. And if the patient knows how, then they may tell them what to do, but they may tell them the wrong thing, or they may miss a step and the family may assume that they know how to do things the right way. So you want to make sure that saline is used, sterile normal saline from the pharmacy or from, I believe they sell sterile saline at Walgreens, but it has to be sterile, not water and not homemade saline. I've seen both used in a nebulizer, and they can expose the patient to serious respiratory infections. So these are the proper steps in administering a nebulizer. It's not a lot, it's very simple, but we have to make sure that we follow these because nebulizer treatments are sent directly to those patient's lungs. So I included this again. So this is the nebulizer cap. I prefer to call it the medicine chamber. This is a mouthpiece, which I showed you guys. Um, let's not sure where it went now, but this is the tube. But anyway, we can see the mouthpiece. So that's the mouthpiece, the tubing that connects either to the compressor or machine, or the tubing that connects to the wall. So we have our nebulizer cap. Instead of a mouthpiece, our patient requested a mask. You see here, and our tubing, which we would connect to the wall. So these are all the main components of a nebulizer. So I just wanted to show you guys this anatomy of this again. So the nebulizer cap, if we want to be 100% correct, the mouthpiece or face mask can be used depending on the patient's preference, and tubing and the compressor. And that's it. Now, step 4 will be to connect the container. So attach the medicine container or the nebulizer cap using the tubing and connect the mouthpiece or mask to the top of the container. So we did that. This is step 4. Step 4. Done. Now using the mouthpiece if you do decide to use a mouthpiece for your patient, then you want to have them place the cap between the teeth, and the patient is to close their lips around it. So this would be the cap, and they should place it between their teeth and close their lips around it to make a firm seal. Then you turn the machine on, or you turn the oxygen on. Once the patient is ready and everything is in place and the medicine is in place and everything is connected, then we turn the machine on. And again, make sure that you keep the medicine container, or if we're being correct, the nebulizer cap, always upright, and have the patient take slow, deep breaths through the mouth until the mist is gone. And how do we know when the treatment is over? It's not like administering a pill to the patient. Once the pill's in their mouth, we know the medicine's done, or an IV. We set the IV pump, it alarms. We can visibly see the medicine is completely gone from the bag. Well, with the treatment, it's not always easy to see if all the medicine is gone. Here, I put a lot of liquid in here so we can see, but we want to make sure the patient gets every last drop because it's only about 3 cc's in here. Well, the medicine is done when the machine starts to sputter. So you hear like a sound, very light, very quiet. That's how we know when the medicine is done, when the machine starts to sputter, okay? Now, some daily care topics, everyday care of a nebulizer. Clean after every use. So these can be reused. Wash the container and mouthpiece or mask with dish soap and hot water. And always let the parts air dry. Turn the machine on to dry the nebulizer quickly if the patient has a machine. Just make sure all the pieces of the nebulizer are dry before storing them away, because we don't want any moisture to build up any mold or mildew. And then the next time we administer a treatment to the patient inhales those germs. Now, if the patient does have a machine, then we want to disinfect the machine and its parts every other day after treatment. every other day after treatment. So you want to soak the parts, except for the mask, in 1 part water with 1 part vinegar, I'm sorry, with 3 parts of hot water, and let them soak for an hour and then let them air dry. And it's as simple as that. Now, some more disinfect disinfect information for disposable versus non-disposable nebulizers. So, of course, for disposable nebulizers, there are 3 different ways to disinfect them after treatment. But if your facility does not want you to disinfect and they want you to dispose and not try and save things and be frugal, that's fine too. Just throw them away and get a new one. But if they do want you to save those parts for a treatment and you see another nurse has put them in a bag but they didn't disinfect them, go ahead and take them out, and you want to disinfect them. Soak 1 part vinegar, 3 part water for 30 minutes, or soak in 70% isopropyl alcohol for 5 minutes, or 3% hydrogen peroxide for 3 minutes. Now, I haven't seen hydrogen peroxide inside of a medical facility available for staff to use, but I have seen alcohol and I have seen white vinegar. So just ask your manager or whomever what is the requirement. How would they like you guys to handle this? But be mindful that if you are using disposable nebulizers, then you should be disinfecting every other day after treatment. Non-disposable nebulizers, if the patient is in a very independent living facility and they are just starting with the nebulizer and you're teaching them about how to clean and care for their equipment, and it's a non-disposable, then show them how to boil their pieces for 5 minutes or microwave in a bowl of water for 5 minutes. Very simple ways to clean and keep them germ-free and disinfect these pieces so that when we go to use them, they are not contaminated with bacteria, and then the patient inhales this medication and becomes sicker than they were before. So we have reached the end of our presentation here. And I have 2 questions. I'm going to test your knowledge, see how well you were listening, understanding, and paying attention to today's presentation. I know we went through a lot, but I'm more than sure you'll be able to get through these 2 questions. So I'm going to read them with you. Question 1. After preparing a patient's machine to administer a nebulizer treatment, the nurse knows the next step is to prepare the medication. As the nurse is preparing the medication, the patient states that she is short of breath. The nurse notes the patient oxygen saturation is 91% and they are breathing faster than normal. Which of the following actions should the nurse take? So, in this scenario, the nurse has prepared a nebulizer treatment for the patient, and as she's preparing this treatment, the patient says that they are short of breath, and the nurse sees that their oxygen saturation is 91%, and the patient is breathing a little faster than normal. What action should this nurse take first? Should it be A, continue preparing the medication for the nebulizer? B, postpone the nebulizer treatment and administer supplemental oxygen? C, notify the doctor and then continue the treatment? Or D, notify the doctor and await further orders? So what would be your first action? What would be the first action you would take after this patient tells you that they're short of breath, their oxygen saturation is 91%, and they are breathing faster than normal? What should this nurse do? Nothing. This nurse should continue preparing the medication for the nebulizer because these are the symptoms that would indicate the nurse to give a nebulizer treatment. So this is almost a trick question. I'm trying to scare you guys into picking the wrong answer because shortness of breath, low oxygen saturation, These are indicators that the patient needs a breathing treatment. So we definitely want to continue giving the breathing treatment. And then after the breathing treatment, if the patient still feels this way, then we should notify the doctor and await further orders. But in this scenario, this nurse should first give the patient the nebulizer, because if we call the doctor, that's what they're going to say. Have you given a nebulizer treatment? Have you given a bronchodilator? Okay, well, call me after, but I'm pretty sure that that will work. That's all the patient needs. Question 2. The nurse is preparing a patient's disposable nebulizer machine to administer their medication. When setting up the machine, the nurse knows to connect the bottom of the medicine container to which of the following? I'm sorry, I always refer to the nebulizer cap as the medicine container. So hopefully you guys can say it the correct way, which is a nebulizer cap. But in this scenario, the nurse is preparing a patient's disposable nebulizer machine to administer their medication. When setting up the machine, the nurse knows to connect the bottom of the medicine container to which of the following? Is it the tubing, the mouthpiece or face mask, the compressor, or the oxygen output? So the bottom of the face mask. I'm sorry, the bottom of the medicine container is supposed to be connected to which of the following? So the bottom of the medicine container or the nebulizer cap is connected to the tubing, guys. Very easy, the tubing. And the tubing then runs to either the compressor or the oxygen output. But the bottom of the medicine container / nebulizer cap connects to the tubing, right? Right. All right. So today we learned about a lot. You know what a nebulizer is and what its function is. We even touched on the physics a little bit of the air and the medicine traveling into a small part of the nebulizer cap and then a larger part mixing with the medication, and that's what forms it into these small atomic parts that can then flow with the oxygen. We went over 2 times talking about the anatomy and the different parts of the nebulizer and their function. We talked about being able to discuss the step-by-step procedure for administering medications via nebulization. We talked about washing our hands, how to make sure the patient is seated upright, and to make sure that we don't turn on the oxygen source or the compressor until everything is hooked up, because we want to decrease the amount of wasted medication and increase the amount of medication that is inhaled and given to the patient. Recognize and differentiate between adverse and general side effects caused by common medications administered via nebulization. So we talked about albuterol as one of the most common bronchodilators and the serious side effects of albuterol. Just in case you forgot, we're going to review tachycardia, fluttering, or palpitations. We also talked about sterile saline, nervousness, shaking, headache, nausea, dizziness. We talked about making sure that the patient, that we're standing next to them when we get them up, because we want to make sure that they're not dizzy and that they have all of their bearings before we allow them to walk. And we also talked about antibiotics and how those symptoms vary greatly depending on which antibiotic we give the patient. But we should be aware that hemoptysis, or blood in the sputum, is a side effect of administering antibiotics via nebulization. And last but not least, understand and discuss different diseases that may require medications. So we talked about asthma, bronchitis, COPD, these different respiratory medications, these different respiratory diseases that require nebulized medications because the patient has an inability to expand their bronchial tubes and the elasticity in the alveoli has decreased. So they're having trouble expanding their lungs and taking in full breaths, and also getting rid of mucus that may be clouding or cluttering their airways and decreasing the amount of inspired oxygen that they can take in. So we talked about those diseases, and those are the patients that we will most likely encounter who will need or be using nebulized treatments. So we've reached the end of our hour, guys. I really hope that I did an effective job today in educating you about nebulizers, that you were able to take a lot from today's presentation that you can then put into practice in your facility to becoming a better healthcare professional and serving your patients better, keeping them healthy, keeping them happy, and keeping them safe. Again, my name is Deontay J. Marquis. I'm a family nurse practitioner and registered nurse in Southern California. And this presentation, again, is brought to you by myalftraining.com. Thank you.